Thank you to everyone for joining us today, and good afternoon. This is the Superior Health COVID-19 Vaccination Best Practices and Successes panel discussion. And we're so fortunate that we've got two nursing homes today to share their vaccination stories and experiences and successes with the rest of us. So we're very excited to have them and thank them very much for agreeing to participate. My name is Toni Kettner, and my co-host today is Jill Hansen, and we'll be trying to make sure this is a smooth running event today. We are both quality improvement advisors with Superior Health Quality Alliance, and we'll get to the introductions, and the members of the organizations who are here today will be able to tell us a little bit about themselves and their organizations in just a bit. So just a couple of housekeeping reminders today. As I indicated before, this is kind of a new format for us, and so we're getting used to it as well. So there's a couple of opportunities for you to ask questions during this event. If you're someone who prefers to type in your question, you can do that through the question and answer function that you should see at the bottom of your screen. And again, if your mouse has been inactive for a while, you may have to kind of wiggle it around to get some of those controls to show up. There will also be an opportunity if you prefer to ask a live question of the panelists who raise your hand, and again, that function should be at the bottom of your screen, and we will unmute you, and then you can ask the question. As a reminder, all of the participants are muted today, and so in order to ask a question, you would have to raise your hand so that we can unmute you, as I indicated earlier. This event will be taped, and it will be made available on the Superior Health Quality Alliance YouTube channel in a few days. We also always share the links to past events on our e-blast and newsletters, so you can look for that. And then if you are also part of Superior Health Connect, which is our new platform of engagement, we'll also be posting the link there. So lots of opportunities to see and to share it. We would like to make sure that following this event that you complete the evaluation of the event. And so Jill will be placing that link into the chat box. And we really take those evaluations seriously. It's an effort for us to improve on our LAN events. And if you have any ideas for future events that you would like to see happen, it's also an opportunity for you to be able to share that with us. So we really do take that very seriously from a performance improvement perspective, and it should take just a minute or two to complete that. So we'll review some of these details again about how to ask questions at the end of the event. So I think that we will proceed. So just a couple of reminders about the objectives for today's events. We've asked the nursing homes to share some of their strategies for ensuring residents and staff continue to have opportunities to become vaccinated, especially now that the clinics have been completed. As always, and throughout the whole kind of history of the COVID-19 vaccines and their development, vaccine hesitancy has been a main topic of concern. So curious to know how they address that among their staff members and residents, and to share any tools and resources, any messaging that they felt was particularly helpful in communicating vaccine information to their staff and residents. And then to share or describe any other lessons that they've learned from their vaccination experience, including any barriers or any opportunities or any kind of unforeseen sorts of things that popped up that they weren't expecting. So our first panelists come from Gilmore Manor, and I will turn it over to Lonnie and Anna to introduce themselves today. So welcome and thank you again.
Thanks for having us. I'm Anna. I work with infection prevention. I'm a nurse here. And then who is not showing their face is Lonnie, but she's in as well.
I'm Lonnie. I'm the director of nursing here at Gilmore. I've been here on and off since high school. So I started when I was 17 and now I'm 41. So I guess you can do the math on that one. I've left and come back several times, but it just always feels like home to me here. I have a lot of passion, I think, for the nursing home and for the residents here. So yeah, that's kind of my story.
Awesome. Thank you so much. And would you like to share a bit about your nursing home?
So we are located in Morgan, Minnesota, which is a town of about a little less than 1,000 people. The total capacity of our facility is 35 beds. And we have housing with services apartments that are connected to our facility, and they have 16 apartments. Our nursing home census is currently at 23, so we are struggling a little bit. But our housing with services is doing fabulous. We have 15 out of 16 apartments currently occupied and 1 on reserve. So they're doing fine. And we have been struggling. When we started COVID, we were at about 31 and then have just slowly ticked down over time.
I think that that's a struggle that many other nursing homes are having as well. So thanks for sharing that. All right, and we'll move on to Pine Valley Community Village. And Angie or Chris or Kayla, would you like to introduce yourselves?
Well, I'm Angie Alexander. I'm the Director of Nursing, and I have done the infection prevention for the most part here until COVID came along, and then it really did become a kind of a team effort because, as I'm sure all of you know, that there were so many additional hats that everyone had to wear. So that's why I'm bringing with me today Chris Glassbrenner and Kayla Kataravic. Chris is our HR director. She's a registered nurse and is the backup IP and has had to really step up and do a lot more. Probably half of her job has become that, along with mine. Kayla does all of my CNA scheduling. So if anybody out there has any empathy for anyone in the nursing home, it would be her and people that do her job. But she has been just wonderful in terms of helping us. As you all know, there's so much with first the testing and then now the vaccinations with all of the scheduling. In fact, Kayla just gave me a report now of the staff that are yet to be vaccinated or on their first vaccination, and so that we can reach out to those folks again. So and I think we've all done our job quite a while. I'll let them tell you how long they've been here in their background, but I started here as a CNA, and then typical story, I just kept staying. And so I've been Director of Nursing since 1994 at Pine Valley. And so, yeah, that's my story. Kayla and Chris, you can tell a little bit about yourselves.
So I'm Chris. I'll be here 17 years this June, and kind of like Angie, started as an LPN, then an RN, and now I'm in my role. Been that HR person, I think, for 8 or 9 years now. I guess I just don't know how to say no to anything. So, but yeah, so I help Angie with the IP stuff, and Kayla's our backup for all of it. So yeah, it's all hands on deck here.
And I'm Kayla. Hi.
Hi,
I've been here for 10 years. I started as a CNA when I was 17, and Angie just hasn't been able to get rid of me since then.
Thank goodness. Thank goodness.
That's awesome. I just think it's so awesome that you all have such a long history with your organization and such a passion for it. That's so really just delightful to see. Angie, do you want to tell us a little bit about Pine Valley?
Sure. Pine Valley is an 80-bed skilled facility, and we also have a 16-bed CBRF attached. And it's a little different location of the building, but it is attached. And we have about 140 employees, give or take 10, full-time, part-time, and per diem. We have our own internal per diem because we're in such a rural area. We don't really have access to agencies and that kind of thing. So we have a pretty robust per diem group of staff, which has been helpful in all of this. But I think, like Anna said, staffing challenges have certainly been alive and well here. We are a county-owned facility as well. So.
Okay, awesome. Thank you so much. So we'll get to the questions for discussion today. So again, as the participants are sharing their experiences, please feel free to ask questions. Again, make comments. If you have any similar practices, we'd love to hear you and have you share those. This is something that we're all in it together, and so it's a kind of an all teach, all learn environment. So we'll start with our first question today, and Gilmore, if you would like to take first stab at it. So I'm wondering if you could just speak to what your current vaccination rate is for your staff and your residents. And then because the clinics are done, what kinds of processes are in place for both staff and residents to be sure that those who may not have gotten their vaccine during those clinic efforts and who still want the vaccine are able to get those. And then of course we have the issue with residents being admitted and or discharged. So Anna, would you like to answer that or start with that question?
Sure can. So our residents, and we call them tenants that live over in the housing with services, we have had a pretty darn good vaccination percentage with them. In the nursing home, we are at 95%. So we did great with that. We just have one in particular that didn't want to get it. And that's literally been our only one. So that's been very good. All of our admissions that have happened so far have been vaccinated already, fully vaccinated. So since that major change of no quarantine with admission, that has been great for us. We do have the opportunity to utilize surrounding pharmacies to get the vaccinations done. I know in our housing with services, which we call Haven, we call them Gilmore Haven. It's a little bit lower over there. Our percentage is about 88% over there. It was a little bit lower at one point because one person was going to be gone having surgery right when we had our clinics. So they recovered here, I think like a month after surgery. So all of the clinics, everything was done. So we did have to coordinate for her. And we ran into a lot of trouble with that one actually, because this woman in particular is less than 65, but has always resided in has been residing in a facility like ours for a number of years, and no one would vaccinate her because she was under 65, even though she fell into phase 1A. So that was very challenging for us, that they would not budge because they were on phase 1B or 1C. It didn't matter that she was already in 1A. So that was tough, but we did get that worked through. And our employees, we have always struggled with our employees getting a good percentage. After our first clinic, we started out at about 30%. We have gotten up to 40% after our second round, So we were lucky and we were able to, we didn't have to coordinate for a third, after our third clinic, we didn't have to coordinate and get any more lined up besides the one resident. So actually, I think we did have one staff member, but that staffing is obviously a problem everywhere. And we helped line up the first one, and then they were no longer an employee very shortly after. So I washed my hands of that. They already have, typically places are great where if you line up the first one, the second one's automatically lined up. So that's been great. With that resident, we had a lot of trouble lining it up. I had to call pharmacies, healthcare facilities, or, clinics and things like that. And I hit a dead end almost everywhere until I got to the right pharmacy that was going to do it no matter what. So that has been my go-to and will be my go-to now continuing, because they worked very well with us in the beginning. But now it really shouldn't be a problem. Just when we really, really needed it, it was a problem. So now unfortunately, we don't have a clinic or we don't have anywhere within our town to give it. But we always are able to line up transportation for residents or someone to go get it. They just come to me for help. So we're working on with new staff. I think we need to work on making sure that we have the opportunity to like reach out. Is it something that you'd like to do? Then line it up, that type of thing. But we've kind of taken a back seat to really pushing the agenda with this because it's been a very heated topic, which I'll get more into later. But luckily we found our routes now of where to get the vaccine, even though we really had a problem in the beginning. So, but I think that covers what I need to cover right now, correct?
Yes, thank you so much. That's awesome. Angie, would you like to share your current vaccination rate for residents, tenants, and staff, and then talk a little bit about how you're ensuring that your residents and staff are continuing to get the have opportunity to get the vaccine if that's what they choose?
Sure. Initially the residents were the easy part. They were like on board from the get-go. And, I think we had as many as 95% of our residents vaccinated pretty quickly. They, like I said, that those that didn't, there was maybe one resident that really kind of, excuse me, dug in their heels and just doesn't get shots. But the couple of others that didn't get them, they were family, disagreed, didn't feel it was the right thing to do or whatever. And even a physician reached out to one of those family members feeling that his patient was so at risk, but the family still elected not to. And, at that point, you have to respect that. Staff has been a greater challenge. You know what, I guess I'll add to the residents. One thing that we have noticed is many of our newly admitted residents have not been vaccinated. And therefore, they don't want to be, because if they had wanted to be, they would have been. We've been able to vaccinate some new residents, but it's funny, probably about half of them have said, no, I decided I'm not going to get it. And while we provide education and encouragement, doesn't always happen. Most of those are short-term people for us. So our numbers will fluctuate, I guess, but we've been between 90 and 95% for residents. Staff, we've been between 70 and 75%. We've actually creeped up a little bit. I am not at all satisfied with that. And I feel like it's really going to affect our residents' ability, our building's ability to really, truly open up. But, it's a fine line between, encouraging and educating and, pushing too hard. I'm sure that Anna understands that, we also work in an environment where we want to respect our employees and we need each and every one of them. We live in a pretty conservative area, and there's just some belief systems that are really tough to work with. I was a bit surprised that we didn't do better than that, because we usually have 90 to 95% of our staff vaccinated for flu. So, I expected the same, and I guess maybe I shouldn't have. We've been able to get a really nice process going, though, for residents that want vaccine when they come in. Our county public health nurse has just been wonderful. And all I have to do is pick up the phone or send her an email that said, I have a resident in room such and such that wants her vaccine. And then she'll text me back or call me back and just say it's scheduled for Tuesday or Wednesday, because that's the days of the public health clinics. So she just puts them on the schedule, so there's a vaccine saved for them. And it's just worked beautifully, because I really haven't even had to think about it. And we don't have to take the residents out, because she stops out here and does it on her way to or from the clinic. So it's been great. We haven't had anyone that has wanted a vaccine that hasn't been able to get one. So that's been helpful. We were really worried about, having to arrange transportation and all of that, and haven't had to do that. So I'm hoping that continues to go well. And again, we're a smaller county and a smaller community, and we just are fortunate that we have that relationship there. Although knowing her, I'm sure she would do it for any of the facilities in the county. She's been had her plate full too, and yet she's been willing to look at our residents as top priorities for getting vaccinated. Staff is a little bit different, and Kayla has stepped in just recently, or I should say I volunteered Kayla. We have some staff, we have a very good system in our community to get signed up for a vaccine. You can go to our hospital's website, you just click on the COVID-19 and all of the vaccine sites in the county are all listed, and you can, about 3 clicks. Well, Kayla can tell you, more about that, but it takes just a matter of a couple minutes to get someone registered. So those of our staff that are not very tech savvy or don't have computers at their home or just are not comfortable with it, I send them to Kayla. And Kayla did it just the other day for somebody. And she said it took like, Kayla, what did you say? 2 minutes or something like that? Oh, I'm not hearing you.
2 minutes tops. It was really simple to do.
Right.
Nice.
So we found like that's a good system. And interestingly, we did have an employee here that tested positive. And of course, we were fully, kind of open and had visitation and that kind of thing. And then suddenly that changes that. And we do think we had a little rash of staff that went, oh gosh, I don't want to be that person that's not vaccinated that brings it in. And they have been visiting Kayla and getting their appointments set up. So that's been nice. It hasn't helped us to get to where we want to get to, but we're moving in the right direction at least.
Okay, thank you.
Mm-hmm.
All right, so Pine Valley, if we'll let you take the first stab at the next question, but can you just kind of share how your approach was in terms of addressing, it sounds like it's mostly vaccine hesitancy for staff. It sounds like the residents by and large were overall pretty gung-ho about getting it, but and what common themes have you seen related to vaccine hesitancy in the staff?
I don't know. I'm going to let Chris tell a little story about this, but I'll say the common themes were it's too new. I'm afraid it isn't safe. I never take vaccines or put foreign substances into my body. I want to have a baby. It might cause infertility. That was a big one. I already have had COVID. I don't feel like I need it, or it wasn't that bad anyway. Or I'm waiting for the one and done. They wanted to wait for Johnson & Johnson. So those were probably, but Chris can tell you a little bit about the infertility thing and how that was handled, because we had, I would say 8 to 10 probably young women that had that concern because there was some talk of that.
Yes, that has been a major concern with the younger women.
Yeah, Chris, do you want to tell a little bit about what you did?
Yeah, so what I did is, we were educating everybody and asking, because when we we were with Walgreens and we had to have everybody registered. So we needed to know who was going to get their vaccines. So we were hitting the floors, asking everybody that hadn't signed up. And that was a common theme. So I asked our medical director and he researched it. He left me a voicemail. I brought multiple people in my office so they could listen to him verbatim, what he was saying regards to infertility and taking the vaccine. I had a couple of the gals who were younger ask me, because I have 2 daughters that work here as CNAs as well, what they were doing. And I said, they're getting it as well. And it was their choice. They got their education on, that there wasn't any science behind causing infertility. So they were accepting of that, and they actually changed their mind and did get their vaccine, which I was very happy with. But I let them, listen to him and said, if you have any other questions, feel free. I can ask him for you. Or if he's here, feel free to stop and ask him. He's more than happy to answer anything. Because we've had some questions about allergies. Some people can't get it for certain reasons because they've been allergic to certain things. So he was readily available. I could send him an email or ask him, and then he'd send me the response back. So I could either print something off for somebody so they could read it, or they could listen to the voicemail and hear what he had to say about it. So that did persuade people to change their minds and get their vaccine, which was good.
Awesome. Yeah, that's so important to have a medical director who is fully engaged in that process and is really available for the staff to help answer their questions. So Anna or Lonnie, do you want to comment what were your common themes in terms of vaccine hesitancy, and what approach kind of did you use to address that with folks?
So with our staff, I did a big vaccine presentation the week of Christmas when I knew it was coming. And we, our medical director advised us in December, when we knew these types of things were going to be coming soon, to ask our residents how they were feeling about it even before they were EUA. So we started the conversations with residents earlier than we did with staff, but I made this nice big PowerPoint, had an all staff meeting. We have troubles with getting staff to come to meetings, but I felt like we had an okay turnout for that one. So I did this big spiel about it. Even before that meeting, I think on our testing days, our testing gal asked everybody, rate where you're at. Are you gonna get it no matter what? Are you on the fence, or are you absolutely no way? So then we kind of had an idea walking into it what our percentage was gonna look like. Mm-hmm. So, and I mean, it was kind of split down the center of, either way. So had this big meeting, and then asked again like a week later, how are you feeling about it? So our percentage, like, Angie, you must have done great, because I never anticipated our staff to ever be like that 70, 80%. I knew there was no way, just with how people have been talking about COVID since the beginning. And we live in a very rural area, and people just did not take it seriously. So I knew the battle we were against. We all could feel it. So before the first clinic, I just did my spiel, went around asking people, and got the numbers. And we were sitting at 30% for staff. For our residents, I went around to each and every resident and took the time, took the paperwork, and, what do you have questions about? Do you want to get it? Do you not want to get it? I called every single one of their families and talked to what do you want to know? And got a good idea of like, yes, I'm going to do it, or no, okay, I'll call you back next week. Let's talk about it again. Think about it. So I never necessarily had a huge issue with residents. We did get one resident turned around, but I can't take any credit for it, because they were unexpectedly hospitalized. And then they talked to other people, and then they decided to do it. Mm-hmm. But they're a tough person anyway, so whatever got them to do it, I was fine with. And our Haven residents, I did the same thing. I had a nice chat with them in the dining room, and really wanted to know what their questions were and how they were feeling. They did great. There was a couple over there that they don't get the flu shot. They weren't going to get it. So we always welcomed conversations and welcomed the questions and welcomed the comments, good or bad, and tried approaching them and answering them and, addressing their concerns as best as possible. Never succeeded with them. And now it's gotten to a point, especially with all the changes, they feel bullied into getting it. And I think that's really how it's turning with residents and staff and everybody. Not residents. Residents have been great. I mean, the one resident now that does not have it, they're just not interested, and that's just the way it is. But it's just one resident. But over in Haven, that's a different story, where they feel gypped, that everybody else gets to do fun stuff. Now, it took like the 3 weeks or something for them to kind of be grouped into the vaccinated privileges. Mm-hmm. But man, was that a tough couple of weeks. So it never eased their hesitancy of it. It wasn't going to convince them of it. It just made them more angry, much more angry as to what was going on. And they were never going to change their mind, which that's where we're at. We're never going to talk about it again and convince them to do it. Like, it's not going to work. But staff, we tried having, again, before the second round of vaccines, we had one of our meetings with our medical directors, like a week before. We got him nabbed, and we had him come, or we did a virtual meeting a couple days before that second vaccine clinic. Maybe had a little bit of turnout, but not necessarily. Most of the people that changed their mind and got it the second time were already like, yeah, I think I'm going to do it, or were already positive and just waiting till they're closer to the 90-day period of time. So we went from 30 to 40%. There's been a lot of side conversations that have happened, and a lot of one-on-one conversations, and those are always tough. Sorry about that. Those are always tough. And you brought up the infertility thing. I always bring this up as a really funny side note, is I have had those conversations 3 times with all postmenopausal women. Talking to a young person, I have a 11-month-old at home. When he was 5 months old, he had COVID, and I had COVID then because of him, and still planning on having children. And then they're coming to me, well, I'm concerned about infertility. And it's like, well, I'm the one that's still having children, and you're like, you're in your 50s and I'm in my 20s still having children. So that has always been a very tough thing for me. And I think I even heard conversations today about like, well, now they're going to be testing on pediatrics, but it wasn't directed towards me. And those situations always get so confrontational, not necessarily from me wanting to do the confronting, but it's those conversations are so hard. And I've tried doing those like coaching things of like, how do we, address their concerns and stuff. But, and then some of the concerns are, well, what are the long-term effects? Like, how do we know what's going to happen in 10 years? It's like, well, we can't have those answers if it's been out for less than a year, So, we've tried, and we hit brick walls every single time, every time. So like I said earlier, we've taken a backseat to not being so in your face about it. I personally think that social media is doing a good enough job with that we here need to focus on keeping our staff retained, and that we keep moving forward and doing the best we can, providing for our residents, and not like, we can't be shoving it down people's throats.
I don't want to create a hostile environment. And it's hard because, I think Chris and Kayla and I, we see the other side of, the extra responsibilities and work that comes with those that aren't vaccinated, and having to approach them, and perhaps personal protective equipment may be different, or where they can dine is different, and all that for both staff and residents. And it's really hard, and in the end, it is their right to make that choice. But then when they get frustrated with the ramifications of that choice, the choice has consequences, then they're upset with me, or with Kayla or Chris or Dr. Smith or the administrator or whomever.
You're the one that's doing it, not that it's countrywide that this is what has to be done.
Isn't that interesting?
You're doing this to us. So.
Yeah, and I cared very much about my staff. I do think that education is the only way that we've been successful in getting where we're at. And again, I'm not satisfied with where we're at, but it was helpful to provide that. I think one of the smartest things my administrator did, and at the time I didn't really even think about it, it was just a conversation, but he came into department head, and all of the department heads and my nurse managers were in there, and he had us go, we went around the room and said, okay, who's going to get their vaccine and who isn't, and who's on the fence, and what are your reasons for whatever your decision is? And that was so informative, because these are all, pretty well-intended individuals. They're educated in their own areas of work, and to hear all of them and where they're at, it was such a good representation of the staff. And then we were sort of able to prepare for that. We provided education then, of course, even in the course of that conversation, and our medical director stepped in the next week and we had a conversation with him about it. Interestingly, all of the department heads and the nurse managers and everything that were in that room, everyone ended up getting their vaccine, which was helpful from setting a good example, but then also they were prepared to have those conversations with their staff when they had them. So I think that was, without knowing it, he knew it obviously, but I didn't recognize how helpful it was. It kind of was like, oh gosh, this isn't going to go well. That was my fear, but it was such a smart thing. And it ended up opening, Chris was present for those meetings, and I think she would agree they were really helpful. Helped me to understand, because for me, it was like, duh, of course I'm going to get it. I can't wait, sign me up. And then there are others that aren't, and I just couldn't, I don't know that I would have understood. It was helpful to hear thoughtful reasons why they were interested or concerned, I think was a better word.
Mhm.
That's a great idea.
I respect that conversation that happened in your department head, because in our facility, I feel like we had our nurses here, I think, did a great job talking about it openly and getting each other to express their concerns, and we all ended up going forth with it. But I think we were set up in the beginning on a negative note, where there were some administration that were very public about it before it was like EUA approved, that I think that hurt us big time. That hurt us big time. And I don't know if we were ever able to fully recover from that. Our medical director definitely helped with it when we had one of our meetings, and he addressed some concerns like backhandedly not knowing who was on what side. That did help, but it hurt the staff, the assistant staff.
Yeah.
That's who it really hurt. So I wish we would have had a better example like you guys had. So
We were lucky, or we were fortunate that
Very
happened,
fortunate.
I think.
All right, this great sharing and really gives a good idea of what's really happening out in the organizations, and just the fine line that you walk sometimes with things like this. You want people to be able to be receptive to education, but on the other hand, you don't want to be, so much in their face that then becomes an issue as well. So, all right, on to the next questions. So let's see, and I was going to remember who I started and ended with, and of course I've been so in tune to the conversation I can't remember. So I think we'll start with Gilmore on this question. Was there a resource or a tool or some kind of strategy for those folks that did accept the vaccine that you found to be particularly helpful in communicating about the vaccine information with them?
I think our best educational opportunity was doing those meetings where I had taken all of the information I possibly could. I worked for like a week and a half just on this PowerPoint. So I did that, and I felt like that was a great basis of it. Our medical director and all of the information that he gets from everywhere, that was an even better step forward for us, that he didn't necessarily have a PowerPoint, but he was there virtually talking with us and answering questions. So I felt like that was great for us there. We did offer to have like Zoom meetings and everything for that. Whether that worked or not for getting people to come, that's the tough part. We did record it where people could listen to it on the computer when they were at work later, that type of thing. We have a staff Facebook page that we like to use that is monitored. I'm going to mention that it's monitored, where only certain things can get posted by, and approved for posting. That has been a negative part too, where people have tried to share, what they see on Facebook of like, the misinformation. They've tried to share that, and luckily we've had the, disapproval process. So we've been able to filter some of what people see, but social media plays a negative aspect on everything, period, with, the misinformation. So that, it was a good thing for us to have that communication between all of our employees, but it also enables other things to be seen. So we do general posts like that, and just always my door was always open, and everyone's door here was always open to literally for just verbally communicate about things. And if I didn't know the answer, we were going to find it with good resources. We were always stressing great resources. So. Okay.
Awesome. Angie, would you and your group like to take a stab at that question?
Sure. I think the one thing, there's probably a couple things that pop into my head. And first of all, early on in the process, we started having, the administrator and I just sat in the hallway, for hours at a time, and people came in and we went through the changes that were happening, through COVID in general. And we carried that over somewhat when we started doing vaccinations. So there were just some opportunities for them to complain or to, express concerns or to ask questions or whatever. I think that was helpful. But through that whole process early on, we said, please pick 1 or 2 good resources and go there to get your information. Please don't Google COVID-19 vaccine because Lord knows what you can get, So we encourage them to use the Center for Disease Control. We encourage them to use the Wisconsin Department of Health websites as kind of their one-stop shops where they could go and get the numbers and they could get, links to accurate articles and that kind of thing. We tried to post those. The other thing that, and Chris and Kayla did a fair amount of helping with this, we did poster presentations a lot for our training. So we have one long hallway that comes into our facility from our employee entrance. And we would take large, legal size paper, and we would have different topics on there. It might have been that we were auditing and people weren't using their, masks correctly or whatever, but whatever it was. And then we carried that on into the vaccinations, so it might be that they're learning about the vaccine safety. They're looking at, how long the vaccine lasts, whatever that looks like. We did a fair amount of that. And I think that was a non-threatening way to get a lot of information to them. They had to review each one and then sign it, that they reviewed and understood. And I felt like it triggered a lot of conversations. I would have people come in and say, I don't understand this. This is what that said. So I knew that they were at least looking at it. It was maybe a little less threatening. And, as you probably know too, and it was really hard you can't get big groups together, because of having to socially distance and wear your masks and all of that kind of thing. So that was a challenge, but we found that poster training, and we've used it a lot during COVID. For other reasons as well. So, and then we just kept all of the posters and the attendance sheet and stapled them together. And when our survey friends say to us, what did you do to train or whatever, we'll have that information there. So I think that was
That's a
helpful. Chris,
great
can you think
idea.
of anything else that we?
I don't think so. I think you covered it all.
Oh, the phone thing. I don't quite understand.
The phone blast. Yes.
Yeah, that was a real find. One of our activity people knew about it. Chris, you know more about it than I do, how it works, but.
Yeah, it's just basically our social worker, Jen. She records a message. We give her the information that we want her to put out, and she records it, and then it goes to recording goes to all our employees. And I believe we also use it for our residents' families too, correct, Angie?
Mm-hmm.
As a way to get information out quickly to people. So
like if we have a
like a
testing day or we have a vaccination day or anything like that, we can say, don't forget, tomorrow is,
Okay.
blah, 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 because getting information out to 140 people when things were changing as rapidly as they were, it was a challenge for sure.
So do people get they get a text message then? Is that what happens? Or
you actually get
a voicemail message?
Yeah, you actually get a phone message.
Oh,
I suppose
okay.
it's how people they probably use things like that to do the robocalls and that kind of thing at political times and whatever.
Yeah.
But it's very affordable. I don't know a lot of the details. If you want information, you could certainly get a hold of me and I can find somebody that could get the answer to you. But it was the best thing we did in terms of being able to reach out to our staff. All of a sudden you have, the facility is closed or you have to do an extra testing session because you have a positive case or whatever. It's been really nice. And it was nice with the vaccination. So surprising the number of people, it's 3 weeks to the day that you're supposed to come in, but the night before they would forget and they'd say, thank goodness you sent me that phone message or I would have forgotten. So that helped.
Awesome. Wow, that's a great idea. Really great idea for all kinds of things that occur that you could use it for in your settings. All right. So let's see. I think we've kind of talked about this next question about the most effective approach. I think Angie, you just mentioned the posters and the telephone messages. Is there anything more that either of you would like to add about the approach staff. I guess I'm also curious, what was to what degree do you feel that peer support has helped sort of move the dial on folks going from being vaccine hesitant to being more accepting? And Angie, I'll start with you.
I think there was a fair amount of that happened after the first round of vaccine, because when they found out that people did get through it okay, that, they didn't, as we've said here, grow a third arm or anything like that, because there's all sorts of crazy things out there, from being microchipped to whatever. I mean, I can't believe anybody could read that and believe it, but it was alive and well out there on social media and some of the news platforms and whatever. But I think just seeing that the staff did okay, and the residents, more importantly, all of our residents got vaccinated on that first day, and they were all fine. I mean, we had maybe 2 residents that had any side effects at all. And we definitely, after the second vaccine, had some staff members that were sick. I mean, they had that response to the vaccine, but I think that that was helpful. I didn't realize that there was a little bit of it going on with our residents, because we had a resident that was vaccinated, was absolutely opposed and wasn't going to get vaccinated. And the second vaccine, she suddenly signed up for it. We were kind of surprised, but glad. And we later found out that she had had a conversation with another one of the residents, and she kind of told her what was what. She said, I'm not going to keep, have to stay in here because you go and get yourself sick. You should get a vaccine. Probably said what we would maybe want to say, but couldn't. And I didn't even know that was happening. We sure didn't share that her vaccination. These 2 women shared with each other. So probably a little peer, I don't know, peer pressure, but influence on both situations. So.
Anna, would you like to comment on the effect that peer pressure had for both residents and staff?
Yeah, I think for us, it depended on who you look to as your close peers.
Yeah.
So, I mean, our nursing staff did pretty darn good. Like, our licensed nursing staff did pretty good with their vaccination record. I mean, I think out of our maybe 10, not even licensed staff, I think like 7 or 8 of us got it. So I think that did, I think 7 of us got it. So there were 3 that didn't. So I think that did pretty okay. But then with unlicensed nursing staff, we did not do very well at all. So I think it really depends on who you look to as your peers for her, and who your support is.
The peer support can go either way.
Support, but who are you going to listen to? That was the point where it's hard to be part of administration that was more pro this and try and relate and really try and get a good understanding, and relay a good message to staff where all of their friends aren't going to get it. All the people they work with aren't going to. So I think it just really depends on who you want to be with, who you want to associate yourself with. So,
okay, thank you.
I think Chris and Kayla and I all talked about the fact that we decided early on we were going to listen to people that were way smarter than us. So, we were going to listen to Dr. Smith, our medical director, and people like that.
Yeah, and I would say with the question before, our medical director, I think, was our best person. I even said to him, I said, people are going to listen to you and they're not going to listen to me. And someone said, oh, no, that's not the case. The next day they came and they said, I listened to the medical director and I think I'm going to get it. And I'm like, I called it. It just depends. I talk to my doctors. I encourage people, send a message to your doctor. That's the easiest thing. They all have this telehealth, send them a message. They'll get back to you. Mine called me that morning. Because I am a breastfeeding mother. I called or I texted him and was like, hey, is this okay? She called me that morning 4 hours before because she knew I was going to get it that day to give me her blessing. So our doctors were our best resources and you had to put forth the effort to do it. So whether they did it or not, I'm not sure. But so.
Okay, thank you. So in the interest of time, and I do just want to make sure that if we have any questions, we have an opportunity to at least take a couple of them. So just one last and brief question. Was there, for each of you, was there a lesson learned or some experience that occurred that you didn't expect, or a barrier or a challenge that you didn't expect through this process? And Anna, would you like to comment first?
Yeah, I sure can. I think, I don't know if I necessarily I kind of expected a lot of the lessons that came with this. I expected our hesitancy rate. I expected why it was like that. I guess I was, my lesson learned for me was just, was more probably a negative lesson of just how disappointing it is, that this is going on and that we truly I guess it was just more disappointing for me that people want this to be over with, but they're not willing to do more work to get it over with, and not to listen to great, I always said, all of the scientists in the world are working on one thing right now. And we have to trust that these millions of scientists are doing it for the better, So, I mean, maybe that was a little tough. And I guess maybe just having those hard conversations has been a lesson, good and bad, but, and I guess it was just good to trust your provider. I mean, me having COVID originally in the beginning, I was like, so why would it be? But I asked those questions. It was okay for me to have those questions, but find the answer that I needed, So I was necessarily not the best example, but I trusted the science. I got the right answers. I felt like I was maybe a good example that way, where was hesitant because of me being positive within 90 days before that, but doing the work to find the answer, trusting the science as a childbearing person that you're going to do better for your community and do better for the people that you care for, so.
Thank you. Thank you so much. Angie?
I don't think I have a whole lot to add to that. I think we there were a lot of learning opportunities through this process from beginning to end, and the vaccination process was just another of those. I agree with Anna. Sometimes it was a bit disheartening as we're all working so hard. And then finding that hesitancy, and you're just not able to move that, meter any further. But what I will say is we've had such wonderful support from our families. They've been wonderful, so grateful for all we've done, are so happy for us. And on that vaccination, that first vaccination day, despite the fact that there was hesitancy with some, there was a lot of joy that day too. I mean, I wanted to cry because I felt like maybe finally we're seeing the light at the end of this really long tunnel. So
I agree with that. I felt like I was jumping for joy on all of our vaccination days. And we were able to provide vaccines for our essential caregivers, starting that, towards the end of it. And that was, I think, the most rewarding for me, because they were so thankful and they jumped right on it, where I felt like I was doing something good for the community to be able to offer that and help them with that. Even though I couldn't get my staff to do it, to be able to reach out a little bit further and help them protect their loved ones, because they are the ones that love the people that are here, that I think made it so much better for me.
That's awesome. All right, so just again to remind folks that there are a couple of ways to ask questions or put in comments for the participants. The first way to do that is to ask, write your message into the question and answer section. And again, that's located at the bottom of your screen, and you may have to kind of move your mouse around a little bit to get those options to show up. And then the second way, if you'd like to raise your hand, we can unmute you and you'll be able to ask your question that way as well, in a more open format to the participants. So again, we're looking for questions, any best successes or best practices that you may have employed, any other kinds of conversation that we need to have. So we'll wait just a minute for any of those to come in. And we have just a reminder while we're waiting. Superior Health has a nursing home organizational assessment that we're asking all of our participants to complete. And the purpose of the assessment is to do a couple things, to not only identify opportunities for improvement for the individual nursing home, but also for us as the bigger Superior Health to be able to look at where there might be opportunities for improvement. And then to develop some great educational opportunities or technical assistant efforts that are really aimed at helping improve those opportunities. And then also to hear from you through the assessment and identify any best practices so that we're able to share those to the greater participant group. So if you need assistance with the assessment or if you have additional questions, you can email info@superiorhealthqa.org and someone will be assigned to reach out to you to just help support you in that effort. So Jill, do we have any questions in the question and answer session?
Just accolades on a great webinar.
Okay, awesome. Any other, anybody else like to ask a question or reiterate what some of their experiences have been with vaccination? I'm curious to know what the sort of information that came out about the J&J vaccine and you know, just kind of how that all unfolded. I don't know if did that affect, do you think, your staff at all in terms of you know, I know a lot of people were thinking maybe the one and done approach was what they'd like to go for. Let's see, Angie, I'll start with you. Any comments about that related to staff in particular?
Just, you know, a couple comments like, you know, see, I knew they were going to find things that went wrong, that kind of thought. And then, you know, more than that, I heard people say, yeah, but it's like 1 in, you know, a million that's going to have this difficulty. You're way more likely to get COVID and, you know, die from that. So, or get really sick or whatever. So I think, yeah, I hated when I heard that it happened because I thought, oh gosh, it's going to affect our ability to encourage people to continue to get their vaccines. I think the greater concern that I have right now is just not moving along quickly enough with changes. You know, CDC has been slow to come out and say, you know, you're safe to do this or you're safe to do that. And now that kind of, you know, in between position that we find ourselves in where we have some vaccinated staff and some that aren't and some residents that aren't. I think my biggest concern is I'm hearing staff and residents say, why bother getting this when we're not even able to really live differently, you know, and you have to remind them, well, hopefully you're not going to get, you know, seriously sick in the hospital or die from COVID now. That's why we really are getting vaccinated. But I think they want more of that immediate reward. And I get that because I'm tired of waiting too. I really do understand. But I think that has been anything that happens negatively along the way that slows things down is a concern.
Yeah, I would have to agree with all that. I also, it's part of my comments back to that always as well. You know, do you know someone on birth control? That percentage is like X higher of getting a blood clot with that. Smokers, we have a lot of smoking staff here. Like, you know, so those are some of my comments back. Like, this is 6 out of like, you know, close to like 10 million. I can't remember the exact number of how many people got it already, but
I reminded them, gosh, aren't you glad that they halted things and they're going to make sure it's safe before they move forward? We can be assured. So, I mean, you just had to turn it around to something.
And that we have a great reporting system, that they're welcoming reports. They're investigating every single one of those reports. Like that was, you know, that's one of my great responses is like, they're looking at them, you know, it's not like they're going in the trash bin. There's
Right.
a huge team of people that are investigating each and every one. So.
Jill, do we have any other questions that have come in?
We do not, Tony.
All right. Well, I again would just like to thank all of you who participated today. This has just been a great opportunity to have a discussion, and I am so grateful to you for joining us today and agreeing to participate. And again, this was recorded, so we will be putting the link on the Superior Health YouTube channel so you can share it with others in your organizations who might not have been able to attend today. So thank you again, and look forward to some other future events that we have coming up on Superior Health related to vaccination. So thanks very much and take care, everyone.
Thank you.
Thank you.